All right, everyone. Welcome. It is Tuesday, February 23rd, 2021, and we are here for our fiscal year 2022 independent agency budget hearings. And this is where we hear from a lot of the external or quasi-governmental or state agencies that we partner with on an annual basis to do all the work that we can't do internally as the Athens-Clarke County government. And so we'll hear from 8 agencies tonight. At a clip of about 20 minutes apiece. So for commissioners, if you have a question or two, there may be time for about that, but we're very rapidly going to have to transition to the next agency. And first up tonight is the Athens Downtown Development Authority that, of course, among other benefits that they bring to downtown, provides our parking services. And I believe we've got both co-director David Lynn and Jeremy from Parking Services with us tonight. So good evening, y'all.
Thanks for having us.
Well, I'll go ahead and start. This is probably going to be the shortest presentation you'll have all night. Essentially, we have the exact same budget that we had last year. Nothing has changed. We are not asking for any money. And with that, I'll open up questions.
All right. David, is there anything you want to add to that?
No, we're one of those few agencies that provide revenue and not take it. So although because of COVID, our revenues are down dramatically, and y'all will see that in the future. I think we're off $750,000 to date because of COVID, construction, and various other parking closures. But all in all, we're doing well, and Jeremy continues to deliver a good product to downtown.
So I guess maybe I'd kind of kick off the questions. Despite the obviously challenges of COVID in 2020 and 2021, and the physical construction on Clayton Street, do you have every reason to believe that this time next year we're back in something of a more normal environment?
I would say so, and I'll let Jeremy bring the experts on that. But our on-street inventory is declining for good reasons. The new design on Clayton Street reduces 21 spaces, along with parklets and the College Avenue closures. That comes at a revenue cost. But all in all, the balance is worth it. We have a new streetscape on Clayton and a new public space with College Square, but those will result in revenue shortfalls in the future unless we raise rates or something of that nature. Of course, all those people displaced on Clayton Street and College Square may be parking farther out or in our structured facilities. We'll just have to keep monitoring and collect the data on that.
Okay.
Yeah, I would add to that our monthly numbers. So the people who pay a monthly fee to park in the parking deck or a parking lot are pretty close to what they were pre-COVID. However, the on-street numbers are not quite what they used to be. Now, I think that's, like you said, a combination of construction, College Square, the ORA. There's multiple things that are affecting the amount of parking downtown. But also, I think there is somewhat of a decline in the number of people frequenting downtown. So we're not quite where we were. We're working to get there. But I do think that we will be below what we were prior.
Okay, thanks. And I know Alyssa and Patrick both had some follow-up questions.
Yeah, I just have a quick question. We added, 80 or so spaces on Doherty Street a couple years ago. And I've noticed that those spaces are pretty much empty, at least during the day. Do you guys have any assessment of what kind of revenue is coming in from those? And I mean, I know if we're losing spaces on Clayton Street, those overflow spaces are certainly available.
We actually, the revenue from those spaces is insignificant, I would say. They're very infrequently used. You may see them on a game day, they're filled up then or something like that with an event. But as far as day-to-day use, they're not used very much. Now, at one point, I believe the hourly limit on parking down there was extended to 4 hours to try and encourage people to use those spaces, especially for longer-term parking. But it does not seem to have much effect, to be honest with you. I think more than anything, people just don't want to walk that far.
2 blocks.
Right.
I have another quick question about extending downtown parking towards Newton Street. We're going to see a big housing apartment complex go up there, and the parking on that is lower than usual. And I know there's been requests for Newton Street, especially from the Grill and stuff. Is there any further discussion about getting some on-street meters in that vicinity?
Well, that would be up to you guys. You know, we have monitored it, and we actually have been running the license plate reader down there. And to be honest, once we started running the truck through there, you know, there was an issue.
I think we lost you, Jeremy. Uh-oh.
I think once Jeremy and his crew started running the truck down there and showing the flag, so to speak, that it pretty much cleared up the issue of long-term parkers parking in those locations.
Okay. I mean, my concern is that once that apartment building goes up and fills up, that you might find folks parking on the street who live in that apartment building or who are long-term visitors to folks in those apartments. So I don't know, we might want to have a discussion about extending that parking in the
I think that's a strong possibility. If the commission wants to add metered spaces along there, it's not so far out of downtown that it's difficult to enforce or to monitor. So if that's an avenue y'all want to go in, we'd be glad to partner with you on that.
I'd certainly support evaluation of the street.
Thank you.
Patrick and then Carol.
So Commissioner Link asked the questions I was going to ask about Doherty Street, but just to expand on some of the questions that she asked. Considering the growth of Athens with the growth of UGA, do you see future need? Understanding COVID and Clayton Street project may be prohibiting people from parking downtown, but do you see a growth in the next 10 years, 10 years for an additional parking deck or additional parking?
Oh, certainly. We've already demonstrated that we've run out of spaces in our structured facilities, and we need one, and we're exploring a new parking facility on the western side of downtown along Doherty Street. It would be, obviously co-mingled or co-used with a different use, an additional use besides a single-use parking facility. But there's no question that we're rapidly running out of long-term parking, especially for our daytime employers and daytime visitors. And within the next decade, I think we're going to see more pressure from the university as they move to develop surface parking lots. Linda and I took a tour of the Innovation Hub that was just opened on South Street, and I happened to catch a glimpse of their innovation planning map, and it shows every surface parking lot on North Campus developed to support that mission. So, yes, I think we'll see a lot more pressure from the university for structured parking, as well as our own employers.
Do y'all have a game plan in place for location, potentials, et cetera?
We do. For the third facility, we have identified parking lot number 3, which is that lot on Doherty at Jackson Street. We have a need for additional parking spaces, and the community has a need for senior housing. And we're working with a consulting firm that will provide both of those uses.
Thank you.
Carol?
All right. I'm going to back up for a second, Kelly and Blaine, or anyone else who wants to help me out on this, and just make sure I understand what we're going through overall. I mean, the Athens Downtown Development Authority is presenting their budget here in front of us, but to clarify, looking at their funds, they don't get any money from the general budget. Is that correct?
That's right.
Right. And is there then are we hearing from them? Let's just put it real simply. So why are we hearing from them?
It's a good question.
We do split parking revenue between Downtown Development Authority and the Unified Government, and they have a contractual arrangement to operate downtown parking with us.
Yeah, yes, I do kind of remember that, but heads filled with a...
If I could too, so the mayor thought it would be a good idea with new commissioners that so every couple of years we have new commissioners, right? Mm-hmm. And so to hear from all independent agencies this year, and next year when we don't have new commissioners, we would only hear from those independent agencies that either requested an audience or did ask for some change in funding. Is that right, Mayor?
That's right, and I appreciate you laying out that framework plan.
I kind of remember a little of that, but my head is full of so much lately. So I appreciate that. And then since you brought up parking and Commissioner Davenport brought that up, as well as Commissioner Link, do we have any, like we just had our co-meeting with the Board of Education. Do we have any co-meetings with the university as a body to discuss issues like parking and housing here, and how we're going to work together to benefit each other? How about that?
Mayor, would you like me to respond?
You can begin. I'd be glad to follow up.
Okay. Well, there's several intersections with the university. I will speak from a staff perspective. I suspect, Mayor, you might mention student government. But so every month there is a meeting, myself and some other Attorney Drake, assistant managers, meet with some of the VPs of the university, and we talk about common issues that are going on. A lot of times construction or infrastructure related. Obviously, issues downtown, COVID related. And so that's been a great partnership. And then just a few years ago, we instituted a meeting of mid-level managers, if you would, from public works and transit. There's a lot of intersecting, obviously, issues with us and the university. And so they've been meeting on a regular basis and have really gotten through some good issues that, talk through and work through issues that otherwise would have become something for everybody to struggle with. So we do have some intersections at the staff level. Mayor?
Well, and I would kind of add to that we've pre-COVID tended to meet twice a year with UGA's SGA, and then just on a recurrent basis as needed with Allison McCulloch, who's in their government affairs office.
Thank you. So there's no, I guess you guys would all report back to us. I mean, this seems to have come up a lot in the 6 weeks I've been on, maybe it's almost 8 weeks on the commission in terms of parking and housing for UGA students as they expand and use more space on campus. And I'd love to be, let's say, more informed if there are any discussions or ideas or vision on that as we're going forward.
Thanks, Commissioner. All right. Any other questions for Jeremy and David? All right. Y'all, please be safe out there.
Thank you.
Look forward to seeing you down the road. Thank you so much.
Appreciate you having us.
Glad to have you here. All right. We are going to transition over to hearing from the United Way of Northeast Georgia. And I think as I look around my screen, I saw Mark Madison on the call. So, hey, Mark. Good evening.
Yes, sir. Hi.
How are you? Good, thanks. I appreciate it. Is there anyone else from United Way, or you get the whole party tonight?
It'll be just me. We'll keep it simple.
Nice. I'll turn it over to you, Mark.
Sounds good. And I believe so I can share screen. I'm zooming. Let's see what I can make happen here. Alrighty. So I'm going to, sorry. Good evening, everybody. I really appreciate you all having me. My name is Mark Madison. I'm our Director of Community Impact at United Way of Northeast Georgia, and I'm here to talk about 211. Many of you likely know about 211 or are aware of our Health and Human Service helpline that serves a 12-county region, our whole 12-county region plus 3, and I'll get into that in a little more detail as we go. I'm going to overview United Way remarkably briefly, talk about 211, its impact, and just want to express that we've sincerely appreciated the consistent support that the county has had, the city county has had for the 211 program. It has been, it has made it such an incredible thing to be able to continue to provide this service throughout the COVID-19 pandemic, before and after. So that's been something we're just tremendously grateful for. And without further ado, I'll jump on in. So we're United Way of Northeast Georgia. We operate in a 12-county region supporting programs and also delivering internal programs in the areas of early childhood success, workforce development, and basic needs. And in those same 3 areas, and here are those 3 areas here, early childhood success, basic needs, and workforce development. But the way that we make sure that our whole community can connect to resources in any of those areas, as well as many others, we have 211. So 211 is our Health and Human Service helpline. It enables any person at any time to be able to reach out and connect with Health and Human Service resources. They can do that either by phone call, to calling 211, texting us at 898-211, or using our website that's always up and up to date, that you can find through our links. Like I said, we serve a 12-county region. This is the full gamut, but Clarke is by far the one that receives the most 211 calls. And I say we also serve 3 additional counties. Those are Walton, Newton, and Stevens counties, but those don't actually fall within our United Way umbrella. They're actually covered by other United Ways with whom we partner. We just happen to be their 211 database provider. So what happens is someone calls 211 and you get through the queue and you press 1 for English, 2 for Spanish, and then you can actually connect with the language line for over 100 other languages. So we make it remarkably simple to connect resources. We try to make it as accessible as we can. And these are just very few examples of organizations you could be linked up with. If you call 211, a real person answers the phone, and they're going to ask a few questions. They're going to say, where are you? Could you tell us your zip code, please? Could you describe to us your age? Are there children in the home with you? Try to figure out what different services are they eligible for, and then help them hone in on, based on their zip code, what is the thing you're eligible for, what do you qualify to receive, and what is in proximity to you. And in fact, we even keep track of bus routes and their proximity to those same organizations, which in Athens-Clarke, that's very convenient. The other counties we serve don't have buses, but for Athens-Clarke, it's a huge boon for those calling. So that's what happens when someone calls, and by the end of it, they can either write down the information that we share with them, or we can actually text it to them right then and there. We can send them a text with the information we just chatted about, or they can, of course, text us in the first place their zip code, and we can work it out via text. So these are the 3 different ways you can get connected to our resource database. Calling and texting is how you get connected to a person that can help you out. Searching online, you can kind of take that matter into your own hands. And a lot of our local social workers and different organizations keep our database up on their desktops so they can search it themselves when they're talking to people. And you can use the Google Maps addition to that same page to map out the resources you might find there. And I'll share, because I mentioned the number of organizations earlier, we have in our database right now listed right at 240 different agencies. Those include nonprofits and government entities. And in just Athens-Clarke County, we have over 100 agencies listed, Health and Human Service agencies, and that includes the numerous sites they may host. Or actually, I should say that doesn't include the numerous sites they may host. They're all roll up into one. So this is, again, touching on some of the things you could reach out to 211 to learn about. Food, Athens Eats Together, has, of course, been a very simplified version of a referral to give. So super helpful there. And any other food resource there might be in the different days and times and changing distributions that may be happening, we can update that so that it's always accurate. Any static paper you hand out might change next week, but we can change 211 on the fly. Housing, a similar scenario. Clothing, community clinics, and well beyond that to domestic violence shelters. We connect individuals who call regarding self-harm. We want to gear them straight toward any kind of suicide helpline we can. or anything in that nature. And so really it can go beyond. We really would love for even more people to call us about employment opportunities and things like that, because those are also things we can refer them to, and we want to help them get connected to that as well. So my apologies, there's a few more clickables I forgot about. So we are looking at a few things here. When I say keynotes of difference, I want to talk a little bit about how our numbers differed this past year, because it was just different. We saw a significant increase in calls in March of 2020. Our calls jumped 65% from the norm, at least across the country. We saw sometimes it increasing by hundreds of percent, so doublings and sometimes even triplings in different communities for a number of persons calling 211. But what we saw, what I think is more compelling, is what we saw different about the things people called about and the circumstances in which people were calling us. So the first one I wanted to share with you all is that we saw a higher percentage of callers who were unemployed. And you're probably not surprised by that, considering the significant difference in employment over this past year. But normally, only 38% of the folks who call us are unemployed, which definitely speaks to some other challenges we see in our community. That lots of the folks who do call us in need are employed, and yet still are requiring the need. But in this past year, we saw it compounded with the fact that 7% more were unemployed. And that may not sound like a lot to you, but it is a big jump for us. We don't see huge fluctuations in these kind of numbers. We saw that more than 50% of the contacts we received had presented multiple needs. So that's someone called and said, not only do I need help with my rent, but I also need help finding food. And that happened more this past year than it did in 2019 by a pretty good margin. While it's not uncommon for that to be the case, we went over 50% this past year. And then for 211, additionally, the number of people who were calling that needed rent assistance was 11% higher in 2020 than it was in 2019, which is very significant, all the way up to 25% of folks who called 211 needed rent assistance. And we anticipate that growing as the moratorium on evictions does eventually. And then we saw it spike in months where the anticipated end was coming before it would be extended. We saw significant spikes in those months. So those are some pieces I wanted to share with you all. And I also want to impress upon you the fact that we can pull these numbers, and we in fact were every week pulling 211 numbers to see contacts related to coronavirus, related to COVID-19, to be able to see what are the trending needs, and we were able to use that and to speak to the Community Response Fund, with which we partnered with the Athens Area Community Foundation to disperse some funding in the area. So it's something that we are really glad to be able to have that real-time responsive need data. We'd love to provide it to you all at any point which you might want or need it. I only have a couple more slides. These are just some things I thought you might want to see. So when we just look at our COVID-related inquiries, about 1/10 of our calls last year, the person said, yes, my need is related to COVID-19. We saw substantially, it was financial assistance, then employment, housing, then food, and testing and vaccination was low on the number of the thing that someone cited as their main reason for calling. However, we would like to see that number going higher when it comes to vaccines. We're definitely trying to refer folks and get them the information they need when they're calling about that. I think part of the reason is, to tell you the truth, I think a lot of folks may not think about 211 for that from the outset. And they also are doing a very good job of getting some information out in other avenues as well. But we are, thanks to the great and consistent support of all of you, the Athens-Clarke County Government and Mayor and Commission, we've been able to really double down on our marketing of the program to make sure more people know about 211, because the more people who know about 211, the less time any of those people have to spend searching for resources, searching for the eligible place to get services from. They can connect with us and get their best next step right away. I'll share this last piece, which is some interesting data point about unmet needs. So we get lots of calls from folks for whom we can provide a referral. We can say, okay, you've got this need for housing or this need for financial assistance. We've got your back. We know the resource to send you to. There are times when we receive calls and someone ask us for a resource and we say, I'm sorry, we don't have that resource for you in this circumstance. And you'll see here the top unmet needs, and it's a relatively small percentage of needs presented. Of all needs presented on 211 calls, and keep in mind, as I shared before, most individuals share multiple needs. We even had one call last year that I think we counted that 14 different things. that they had said they needed on the call. So that means that many of these were people not necessarily in Clarke County because it's a regional scope. So when we look at shelter and housing, usually there is a referral in Clarke County. However, in our regional scope, there are very, very few referrals for shelter and housing. For financial assistance, there's usually something, but there may not be. Motel bill and voucher is very rare to find, really, in any community. There's a few more now, considering the constraints that shelters are on, but still a rarity. The majority of the reasons why people don't receive assistance is because there's some kind of eligibility, either an area limitation, or the service does not exist. The service doesn't exist in their, at least, location. But additionally, we see kind of on the tail end of reasons why folks aren't we can't find a referral for them, may even be that they just don't have the transportation. But most often, we see it being they're ineligible for the service, or the service is just not available to their particular demographic, which is kind of a similar thing. I had a slide about that. Well, I said these things. I won't harp on it too long again, but generally it's service not available, but this sometimes means it's not available in that area. There maybe no spaces left. There may be no funding left in a particular program. Callers that qualify for assistance may have tried all those referrals or refused the referral even, which does sometimes happen, or transportation is not available. So going back to the beginning, this past year we were able to respond to well over 5,000 calls, but also texts and also many, many online searches. We were able to do that through the midst of the pandemic, even at the very beginning, when we weren't sure what organizations were going to stay open and not open. We were responsive to that regard, and people were able to access this information anyway. And we're really proud of the fact that we were able to do that, and we're glad that we've been able to partner with you all to provide that service. And I'd be remiss if I didn't say thank you to all of you for sharing about 211. I know that the county page shared 211 on 211 Day, which is February 11th, which is just cool to us. So we appreciate the shout out on social media, and any chance you can get to share 211, to share information, is a chance to get someone just another step closer to finding the help they need. So, you know, the way we say give, advocate, volunteer, and when we're talking about 211, we really hone in on advocating. If we can advocate for folks to get the help that they need, to find the resources, to make it as simple for anybody to find it as it is for anybody else, that's what we're here to do. So I'm happy to answer any questions you might have, any specific questions especially. And I'll stop sharing my screen for the sake of making it easy for everybody, unless you want me to go back to the screen. Yes. Listen. So I think you're muted, and I can stop.
Sorry about that. Yeah, you said y'all answered about 5,000 calls in the past year, as well as text messages and online searches. Do you have any numbers for the text messages and online searches?
I do have numbers for text messaging. Text messaging, the online searches I don't have right off the top of my head. I'm sorry about that, but I do have. For text messaging, we were closer to. Actually, I just remembered I do have all of these written down. We were closer to 1,000 text messages actually. Okay. So okay. It was a higher percentage than we'd experienced in years before. So that's a common trend. Nationally, we're seeing most 211s, because I should share this as well. For anyone who don't know, there's a 211 covering more than 90% of the U.S., most of the time operated by a United Way or partnered with a local United Way. And a little over 85% of Georgia is covered by a 211.
And my other question has to do with your grants. Y'all give community, I've been digging around on your website, and you give community grants. Do you have a list of the amounts for those grants? I know you've given to Project Safe and CASA and Boys and Girls Clubs and stuff like that. Can we see a list of the amounts?
We have not put out a public list of the amounts at this point. It will likely be a part of our annual report, but that we'll put out later next month. But I will certainly let you know. It's not something that we've published as of now, though we have the people who were funded. We did not publish the amounts each organization was funded at.
Do you have a past list of how much they were funded at? I'm just curious to know how much goes out to these independent agencies or these independent nonprofits.
Oh, sure. Yeah, we have the past years as well.
Yeah, I'm just kind of
Yes,
curious.
Sure, I can share that with you. No problem.
Great, thank you.
I'm happy to.
Other questions for Mark? Carol?
Yes.
Hey, Mark. This is nice to meet you because Erin Barja from Envision Athens just texted me your name yesterday when I said, who knows about all the social service support networks in town? I see it's all right here now. The money that for this 211, I'm assuming that goes to staffing, our contribution. Is that correct?
Yes, the major portion of it goes to ensuring that we can provide the program. To break down the nuts and bolts, we used to provide a call center here in Athens, and I actually was one of the volunteers on that team at the time. It's been about 4 years since we did that. We then started partnering with United Way of Greater Atlanta, who actually has a significant call center that can really scale up, and they had already been taking calls for other communities like Columbus and Augusta, and was moving to do so in other communities. And so we saw that as an opportunity to connect with a greater deal of professional development. And they also had bilingual call agents, which was a huge help and an asset. And they also had the texting platform that we did not have at that time. So we were able to link up with them to provide that portion, whereas we provide the database support. So all of that information, all of the resources that actually refer folks to, that comes from what we put into the system. But they have the professionals that are really good at resource navigation and talking with individuals who call to figure it out. So most of those funds are used for that, but there is a significant portion of the funds we're starting to use for promoting the program, which is something we've never actually had the space to do before.
So to clarify that on this, I mean, so if I was like someone working in social work or anywhere, or actually if I'd known about this when I was at Athens-Tech, I could go in here and I'd have trust that this stuff was up to date. Like I'd have someone that's what, and so that's you're working on that. There's someone there checking all those links and checking all that information is there. And how long has this been around, the 211?
Yes, we have. The program itself, 211, has existed since the mid-90s, early 90s, in fact. And Atlanta was the first 211 in the nation. So it was actually the first place to have a 211. The FCC, I think, set aside the 211 number either mid to late 90s or even 2000, somewhere around there. And so it's been around for a while. In our community, we've had 211 since the early 2000s at least. Tim Johnson was a part of that program actually at its onset. As you could imagine, he's at everything. And so that would be, it's been around for a while, but that's part of the reason why we're trying to get space in our budget to use some funds to promote the program, because that has probably been the biggest barriers. More people need to know about it, truly. And yes, we are consistently checking up with those resource links and all the information that's available. We don't just search their websites. We actually give every agency access to the database. And we send them at least once a year. We request that they update their information. And then we go in, double check what they type in there, correct any potential misspellings or whatever, and make it all look the same for our people searching. And then we have that ready and slated to go. And we call that our formal update. So the main line of success for us is what percentage can we get formally updated. I'll admit this past year was a little harder to formally update with so many organizations shut down. But we did what we could and called as many as we could. So
do local places, like, for example, I'm just going to use my Athens-Tech again. Is there someone there reaching out for you and saying, hey, we do professional development and demand that, require, I should use, that all the employees do that? Could you do a session for us? Do you do that kind of thing at Athens-Tech or other places?
Do you mean, do we list things like Athens-Tech as resources?
No, I mean, you knowing about this and using it, and you're saying getting it out so people know it, I mean, are people someone at St. Mary's?
You do like a dog and pony show.
Yeah, dog and pony show to go out to promote it among people.
Yes, we are, but we're always looking for more of those. I've gotten to do those trainings with small groups like Michael Bean's team. That does street outreach at Advantage. I've gotten to do those. Most recently, you just mentioned Athens-Tech. In fact, Jen Wellborn and I just spoke yesterday. She picked up a bunch. She's at Athens-Tech and picked up a bunch of 211 cards.
Oh, Jennifer Borg.
Wellborn is what I meant to say, actually.
Okay,
Sue
okay,
Wellborn
got it.
is who I'm
Okay.
speaking about. Maybe two different people.
Okay.
But she picked up 211 cards and posters, which we have loads of, and I'd love to give them to as many of you as might possibly see someone in person. I, of course, know that most of us are, but still.
Thank you.
Yes, ma'am. Yes.
All right, y'all, we've got time for one more question. Go ahead, Jesse.
Thank you, Mayor. All kinds of stuff I'd love to talk to you about, but sticking to the budget part for now. I just was hoping that you could elaborate on, I see the personal services line item versus the operating expenses, and it went from 5,800 down to 0, and now it's back up to 900, and just, why that's doing that differently each year?
Absolutely. That's a really good question. So the main reason was so my role is the one in our office who oversees 211 in its database. We used to split out the salary for my role based on the two programs we were running internally, as well as the United Way overall budget. We determined that to be a bit superfluous, and also that since significantly most of my time is spent working on the United Way General Program, we just folded it into the overall United Way budget. So it's no longer paid out of particular program funding. We use that funding for that program now, and United Way overall budget pays for my time. However, in this upcoming year, that was the reason it went from that to 0. So we were paying like the percentage of my time spent working on 211 was what that number used to come from. The $900 is our hopes to actually utilize UGA's Federal Work Studies student program, worker program, which is an awesome program. If you don't know about it, tell your nonprofit friends about it. Where they actually help by hiring the student. Well, we of course interview and hire to work on the program. They will pay them, help us pay them $11.25 an hour, whereas we will only actually pay $2.81 of that per hour. So they would pay the large majority of that student's hourly wage, so that we could have a worker that is, because we want to be able to pay our interns flat out is what I really want. So we've had interns working for free, but the fact that we could actually pay our interns would be a huge benefit to them and to our organization. So, but I'll share with you that if they're tutoring kids in math or reading in elementary school, or if they're working with pre-K families on reading, then that percentage paid that's covered by UGA or by the federal grant is 100%. If you don't know nonprofits working in that space, let them know that's a great opportunity.
All right, Mark, thanks a ton. We really appreciate the work you do at United Way, obviously throughout the region, and it's the hub. We're glad to be a partner.
Well, thank you. I really, really appreciate y'all's support, and thanks for the time to get to talk to me. If you have any questions about 211, give me a call, shoot me an email. I'm happy to talk about it, help out however we can. Thank you.
Great to see you. All right, everybody, we are going to transition to hearing from the Clarke County Health Department. I know we have a handful of folks from the Health Department here. We've Emily Eisenman is with us, as well as Whitney Howell, Dr. Stephen Goggins, and Sarah Peck. So welcome, everybody. I'm going to go ahead and turn it over to the Health Department team.
Thank you, Mayor. You did a great job introducing our team. We do have our interim health director, Dr. Stephen Goggins. Whitney Howell is our director of clinical and nursing services, and Sarah Peck is the manager at the Clarke County Health Department. So let me share my screen. I'm super familiar with doing this here in WebEx. We're teams here at the Georgia Department of Public Health. Okay, can everyone see my screen? Good. Okay, great. Thank you all very much. Figure out how the controls are going to work here. Let's see here. All right, great. So I wanted to give a brief little overview of what all the health department does. I know that some of you might be a little bit newer to seeing what we present for these budget meetings here. So I'm not going to read every slide, but I do think this little mission statement here is very well put. The mission of the Athens-Clarke County Health Department is to promote and protect the health of all our residents. The health department collaborates with individuals, families, schools, hospitals, service agencies, and businesses to improve community health and enhance quality of life for everyone in Clarke County, especially those with limited resources to care for themselves. So some of the broad topic things that the health department does, we offer clinical health department services. We do health education. At the health department, we have vital records, birth and death certificates, and then we also do environmental health. And we'll get to that in a moment as to the specifics of environmental health. So the health department services generally are immunizations. We do flu shots. We do those in the clinic. We go out to schools and do flu shots. At the Clarke County Health Department, we have a travel clinic to have some of those unusual vaccines that you might need for international travel. Not that anyone's doing that right now, but, and then we will get to our COVID vaccine. I'm sure you're all curious about that. We do a lot of infectious disease testing, treatment, case investigation. We have a robust women's health program, which includes breast and cervical cancer screening and family planning and other women's health needs for anyone, regardless of income. We do have a hypertension prevention and treatment program. We are the local provider for the WIC program, Women Special Supplemental Nutrition Program for Women, Infants, and Children. We do health education. That's one thing that we really are proud of, our work in health education in the schools and running Teen Matters, the Teen Matters clinics here in Clarke County. And then, as I mentioned before, we do have vital records, birth, and death certificates at the health department. So give you an overview of what health department visits in 2020 looked like. I will say that in 2020, visits were down a little bit because we had quite a bit of time where people were just not coming out to the health department as much. We did do telehealth where we could. We did things like giving women multiple months of birth control and those sort of things as best we could. So this just gives you some overview. We do serve all ages, represents here the various race and sex breakdown of the patients and the percent served here of the population in Clarke County. I'll speak very briefly about environmental health. We do restaurant inspections, we do food service training, septic tank permitting, and also mitigation when people call when they have problems with their septic tank. It's quite hot right now when we have a lot of rain. It's always a busy time for them. We do also inspect public pools and spas. We do rabies investigations, testing of well water, and we do inspect tattoo or body art establishments, and we also do the licensing of the body artists. You see here up in the corner, these are the numbers. There were some restaurants that went out of business, so restaurants were down a little bit this year because a lot of them were closed down, so we weren't called to inspect on them. We do 2 inspections every year for restaurants, but that gives you an overview of the level of activity for this past calendar year. Now, what everybody wants to talk about, I'm sure, COVID-19. I wanted to give some perspective on this, what COVID has done to the work that we do this past year. So for starters, at testing, we did over 34,000 COVID-19 tests since March 17th, 2020, so just shy of a year. There's no comparison here because we didn't do COVID testing before. We really don't do much of any kind of testing other than infectious disease testing. So that's pretty much a standalone number. It's quite a bit. We are still testing at the Oneida Street site 3 days a week. Immunizations is a very interesting number. We have done almost 15,000 COVID-19 vaccines administered since we started on December 18th of last year. That is triple what we do of all vaccines of all types in a typical year. So we're only a couple months into this. Notifiable disease follow-up. This is, well, in the context of COVID-19, it's what you might hear called contact tracing. It's really much broader than just contact tracing, but we have done over 45,000 contacts that we followed up with related to COVID-19. That would be people who tested positive and anyone they reported being in contact with and that sort of thing. In a typical year, we do this sort of contact follow-up for sexually transmitted diseases, HIV, that sort of thing. In a typical year, it's a volume of about 2,100. So again, that's been way up this year due to COVID. The graph down here gives you a perspective on the age of the people that have received vaccinations so far from us. We are currently in phase 1A+, which is healthcare workers, first responders, residents of long-term care facilities, and those age 65 and up. As you can see, most of our vaccinations have been given to those 65 and up. That's about 71% of the vaccines we've given. There are some younger ones down to 18 years old. Those are generally healthcare workers or police officers, firefighters, EMTs, that sort of thing. And then between the very young, it's just pretty evenly spread out. And again, those are primarily healthcare workers, but a good amount of first responders. So, Mayor Gertz was at our press conference where we did the first vaccine in the entire district. We were really excited to have the honor to do that. Dr. Ferris Johnson, who is a family practice physician in Athens, was the first recipient. Fun fact, this is Whitney Howell, our nursing director, and she precepted with Dr. Johnson when she was getting her nursing license or nurse practitioner license. So she gave him the first shot, and that was quite exciting. So I wanted to speak briefly about our COVID-19 outreach. This is something we're really actively working on. Sarah Peck is heading up our outreach efforts. We are targeting those who are underserved, who may be homebound, have transportation barriers, technology barriers to registering for the vaccine, and even vaccine hesitancy. And that would get into some education, outreach and education. We do have a very strong partnership with the Athens Free Clinic and the UGA Medical School students, where we assist them with going to their target populations and providing vaccines. We partnered with them first when they were going out and doing testing. They have now shifted their focus to vaccines for those, and we will continue as we go into new phases. We'll continue to work with them on the populations, the Latina population, homeless populations, that sort of thing. We also are developing some really great partnerships with the hospitals and clinics in the area, as well as the Athens Area Community Foundation, the Council on Aging, and other senior centers, because these are where the people that we want to target are, or they have inroads already with the communities that we're reaching. This week, we have gone with what we call the UGA Mobile Clinic. It's the Athens Free Clinic UGA partnership. We were at Columbia Brookside and Denny Towers already this week doing vaccines, and this photo is at Columbia Brookside, I believe. And we have a Latinx event at Community Council on Aging next week in conjunction with the UGA group. So besides COVID, we do have other things that we will be working on this next year. We're expanding our HIV program. We are offering the PrEP in the health department. That's pre-exposure prophylactics for HIV prevention. We will be expanding our nutrition services in our HIV clinic. And we are planning to pursue Ryan White Part D funding, which will allow us to serve youth under 18 who are HIV positive. Another exciting, these next two bullets really are somewhat tied with schools being in person. Really exciting thing is an asthma clinic. We have our Children's Medical Services program has children who have asthma, and oftentimes they have trouble getting to their appointments. And so we are going to, we are already partnering with the school district to use their telehealth and their nurses to offer asthma clinic visits using the Children's Medical Services asthma providers, physicians who are doing the asthma treatment right in school. So we don't have those children missing out on appointments because they don't have a way to get to the clinic. We also will be re-expanding our health education to the teens, getting back into the schools when the schools are open, ramping up those Teen Matters clinics that are open after school for the teens to come to get confidential services, education, just anything that the teens need. We'll also get back in when we can into the lunch hours where we are there for when the teens have questions about all kinds of health subjects, sexual or non-sexual. So to wrap it up, I am offering this great picture. This is the last time we all got together without masks. This was Christmas 2019 at the holiday party at the health department. We are requesting level funding that the Athens-Clarke County has been very generous and given us $946,354. We are asking for flat funding. We are able to continue our work with our current level of funding. And so the health department, on behalf of the health department and the health district, we thank you very much for your support. So I'm going to stop sharing my screen and answer any questions. And I also have my backup here, which would be Dr. Goggins and Whitney and Sarah Peck for a lot of these questions, I'm sure. So
thanks, yes, Emily. And before I turn it over to others, just looking at your budget layout, I've noticed that from FY20 and FY21, you anticipate a significant decline in county interagency funds this year. Can you explain for all of us kind of what those are and why you expect a decline there?
That's right. Right now, we are receiving money from, it goes from federal to state down to the local level for COVID response. We are anticipating that funding will continue through June 30th. We do not know after June 30th what the funding will look like. So I always have a very conservative budget. We have not included anything like that in our budget, because we just don't know what that funding will look like. So that would be the drop. We've received, as you can see from the numbers, we've done quite a bit of COVID response, and we have been compensated from the federal government or from the state and the federal government for that.
Okay, thanks. And I know a handful of questions were there. I think Patrick, you had your hand up, and then Melissa.
Thank you. Just really quick, when it comes to COVID and contract tracing, can you give us an overview of where most of the residents are catching this? And second question, outside of COVID, what is the biggest health need? I think last year was something, what's the biggest health need and contract tracing where people catching COVID?
Dr. Goggins, do you want to address that, especially the epidemiology question?
Sure. Let me try to do that. It's actually more difficult than it seems to say that, because when you have widespread community transmission, it's not always easy to nail down precisely where somebody might have gotten exposed. But it does seem like around the holidays, in particular, small gatherings or medium-sized gatherings, social settings, I would think have been the ones that have been the most risky. So people might do very well at work and other settings, but then they do go out to somebody's friend's house for a dinner party or something like that. That kind of behavior does seem, to my mind, to be the highest risk for the general population. The second question was about biggest health need, I think, of the, if you remind me.
Yes.
Just the biggest health need of the county?
Yes, for ACC. Or health concern.
Sure. I still think that it's something we have revised our program on this year. It's metabolic diseases, diabetes, hypertension, some of the chronic diseases of adulthood. So this year we did revise and rolled out a new hypertension and diabetes set of treatment protocols. We've been spreading those to all the health departments, getting training to the nurses, and I think that's going relatively well. I say this year, right? This is where my head is. It was actually starting to get to, a year and a half ago. And unfortunately, we never really got to grow it because we put it in place and then we got a whole bunch of COVID. So I think that will be something once we get to return to normal clinical activity that we'd want to put more time and effort in, because it's such a prevalent problem across the community.
Thank you.
I think Melissa, did you have a question?
Yeah,
And Russell did as well. And,
yeah,
and then we'll
thank
wrap up.
you, Emily and Dr. Goggins. I know that this county's done a really good job with COVID testing, and I know this local government's been able to assist in funding some of that. And we had a lot of success with that pop-up mobile clinic, the one that UGA sponsors, as well as the one that Habitat for Humanity was able to pull together in the last couple months of this past year. I know there's a lot of challenges in replicating something like that for vaccinations, not only in the supply of vaccinations, but from what I understand, there are particular state requirements for vaccination locations and also particular qualifications for those who can distribute the vaccine. And I know that, as more vaccine becomes available, which apparently is going to happen in the foreseeable future, we're going to want to ramp up vaccination clinics. Can you explain some of the challenges to replicating that kind of mass testing in a vaccination program?
Dr. Goggins or Whitney?
Yeah, so I'm trying to make sure I understand the question exactly. So there's challenges of doing like a mobile kind of mass vaccination in a mobile way?
In getting some more mobile clinics out there for vaccinations and more pop-up vaccination clinics in more community-oriented settings, going particularly into communities to get vaccinations out there in a broader way.
And I think Whitney will have a good perspective on this too. From my perspective, it becomes easier as the criteria for vaccination become broader. So one of the challenges that you would have right now is that you really are targeting 65 plus. And so that would limit you where you would go in terms of neighborhoods, for instance. You wouldn't go to most work sites and be able to get a good group of people to vaccinate. But if you were doing general population, all those things would be available. The other thing I think is about, although by now I think we're much better, at the beginning, handling of these vaccines are a little challenging to manage in terms of their need to be ultra cold frozen and things like that. But I think we're at a place where we can do that more successfully. We really do believe that mobile is a strategy that needs to be increased because it corrects for a lot of the barriers that our current, just broadly, everybody's access to everybody's system for registration puts up. So I'm with you. We definitely are trying to expand our mobile. There are some issues, but I think it's a great strategy. Whitney, do you have anything that you wanted to?
Sure. Yes, I definitely agree with that. And so that's where we're trying to focus some of our efforts now. But in terms of the logistics, it just involves a good bit of training on the front end to make sure the event rolls smoothly like you would see with testing. Because with the vaccine, of course, you have to have the storage and handling of the vaccine. And it does require personnel that are trained at a different level than testing. But currently with our UGA partnership with the Athens Free Clinic and the med students, we are going out into several areas that Emily has already mentioned, but hitting the Columbia Brookside, Denny Towers, Athens Council on Aging. And thus far in this type of semi-mobile operation, it's run really smoothly, especially when we have these built-in partnerships with UGA, with these community facilities, and already built trust with the residents there who are already getting primary care. And so I think having a good relationship builds that trust and alleviates a lot of the barriers.
And then
and I also want to share that when the phases do expand open, they also have a partnership, say, with Foothills, Clarke County School District Schools, Nucci Space to target some of our essential workers, restaurant workers, and of course, Potter's House. So thank you.
Thanks.
That's a great overview. I appreciate it. Good question, Melissa. I know Russell had a question too, and then we've got to move on to Athens Neighborhood Health. Russell, you there?
You might be muted, Russell.
Sorry, y'all. Hi. Ms. Eisenman, you mentioned that y'all had administered 15,000 vaccines. Is that the full course? 15,000 people have been vaccinated locally in Athens-Clarke?
That's 15,000 shots in the arm. A lot of people, I believe, I know a lot of people have completed their course, and some, that would include some that were just first dose that are not ready yet for their second dose, because it's either 3 to 4 weeks later.
Okay, gotcha. Thanks. That's all.
All right, y'all. I know we could spend a lot of time with Department of Public Health, given obviously the circumstances of the moment, but I will say it's my 15th year as a member of this government, and Emily, for that entire time, you've had a year in, year out, very consequential benefit to the community in terms of those diseases Dr. Goggins mentioned earlier, hypertension and diabetes. I think you've helped curb the teen pregnancy challenge that was very acute in the early and mid 90s that really is quarter now of where it was at that point. And so kudos to all of you and the work you've done. All right, everybody.
Thank you all very much. Thank you, Mayor Gertz.
Thank you.
Yes, definitely. All right, y'all, we are going to move now to the Athens Neighborhood Health Center. I know we've got a number of participants. I think I see Director Marcus Garner, Board Chair May Walter, and John Wolf, all from Athens Neighborhood Health. So welcome, everyone. It's good to see you. And I'll go ahead and turn it over to you to present.
All right. Well, thank you very much. Thank you for the opportunity as well. And we greatly appreciate these resources, ongoing resources. Just a brief history for some of the commissioners that Athens Neighborhood Health Center may be unknown to. We are a federal qualified health center. And our mission is to provide affordable, high quality health services to all individuals in the Athens-Clarke County area. Our patient population is made up of uninsured, underinsured, underserved population. And for the prior years of activities dealing with these resources, they allowed us on last year uninterrupted services during this pandemic era. So we were highly, greatly appreciative of that. With the ongoing leveraging of our resources, we were able to provide primary care to over 6,200 patients and provided an average of 3,500 prescriptions per day. And one thing we were really pleased about and to offer to our patients, reduce our nominal fee from $45 to $25. And also we were able to add behavioral health services. This is the first time the community health center provided behavioral health services. And our licensed clinical social worker, we brought that person on and been seeing patients for the past 4 months. I believe he's close to 90 patients and had over 170 sessions. So we were very pleased with that. And in addition to with the Department of Health, as far as testing and vaccination, with the leveraging of these dollars, we were able to test over 6,500 individuals. And that was some with the county partnership. As mentioned earlier, we had a partnership with the Habitat for Humanity. And with that particular partnership, I know we tested close to 1,500 individuals just on that project alone. So we was very pleased with that. Although our numbers were due to COVID, our numbers were reduced by 13%. But I think the main thing out of this is the key point, what I said earlier, as far as with the resources such as you all provided, we had uninterrupted services. We had no closures or layoffs or things of that nature. We was able to constantly provide comprehensive healthcare services. What we like to do as far as, for the upcoming year for the services, for the resources, is just continue enhancing our general operations. We like to leverage the funding as far as when it comes to not only with testing, but also vaccination capabilities, enhancing that. We've been doing that for the past couple of weeks, and we have vaccinated close to 300. And just like Emily said, that's 300 shot in the arm, not necessarily 300. Well, no, it's 300 people. 300 people, yeah. I don't have the numbers as far as who completed their series. But to do that, and then last year we had a proposed deliverable where we wanted to expand our east location on McKinley Drive. But due to some, the COVID outcome and so forth, and put emphasis on that, that's one of the things that we're proposing for this year. We already started. We identified an architect, and the city has Athens-Clarke County has worked with us on as far as identifying vendors to help us to complete this project. Hopefully by the beginning of summer or midsummer, we could break ground. But we are going to expand our east location with the 6 medical exam rooms and 3 dental. So that's, again, we'd like to use those resources for that. And I'm going to let my CFO chime in and discuss some other activities as well.
All right. Unfortunately, your CFO doesn't know how to work this program very well. I'm very sorry about that. But yeah, we're really excited. Last year was a challenging year for everybody in the medical industry, and but we got through it very well. Fortunately, we had our partnerships, and Athens-Clarke County was one of the best ones ever. As we said, we'd like to. I know we've met before. Marcus and I have met with Manager Williams and Mayor Gertz to discuss the possibility of expanding the East Clinic. And that's where we see would be a real opportunity at McKinley Drive. As you all know, that facility backs onto the public housing authority, the public housing project at Nellie B and Vine. And that gives us a real opportunity to expand much needed primary health care for that community, which is very underserved. And we think we could be a great partnership for us. I think it was mentioned last year at this time that our biggest challenge is trying to make sure we have a long-term lease rather than just an annual lease. I know Mayor Gertz and Manager Williams and we've all discussed that so we're having all the meetings we've had with your central services department, your speed loss managers, everyone that you've referred to us, your facilities manager have all been very positive, and we're looking forward to that. That's one of our main issues. Also, as you all are, I'm sure, very well aware of, our property downtown at our College Avenue location is very much a part of the Mayor and Commission's master plan for the north downtown. So we're looking forward to being a partner, continue to be in a partnership.
I'm sorry, I didn't mean to, John, but I was going to ask May if she has some closing words before we take questions.
Hello, everyone. No, it's just that Athens Neighborhood Health Center has been around we're coming up on our 50th anniversary. In 1971, we were incorporated in June of 71. So we're coming up on 50 years of providing health care to this community, and it was just as much needed then and it's needed even more now. So as I was listening to the health department and the 211 United Way talk about the increase in the number of calls for service, and those same people that are calling 211 also out of jobs, they're also out of health insurance. So there's going to be even more need because of this pandemic for people to be able to provide quality health care in this community. And we're looking forward to being one of those key players in this community so that people will turn to the neighborhood health center and know that they're going to get quality health care. So we've enjoyed this partnership, and we want to continue to do what's best for the community. And I think we all have that goal in mind. So that's what we want to do, and we want to continue to partner with people of like mind who want to do the same things. So we're excited about the opportunities that we have coming before us, so that we can expand and do more. So again, thank you. And I am, well, how do I want to put this? I am transitioning out of my role as board chair because of my term expiring. So Dr. Henry Young will be our new board chair, and I know you all will work with him just as well as you work with me. So I'm not even worried about that. But I'm not going anywhere.
Well, we're glad
I will
for
be
that.
around.
We're definitely glad for that, and glad for the work at the Neighborhood Health Center at both locations, and excited about service expansions in recent years, and then the prospect of more rooms over at McKinley Drive. So we've got a few minutes. Questions from commissioners. Melissa.
Yeah, thank you all so much for all your hard work. I've gotten to know a lot of y'all better through those Tuesday meetings, and I know you guys have been working really hard, and you've done a lot of great work, and I'm really grateful for the testing commitments that you've had throughout this whole crisis. I just have a quick question about the addition of behavioral health services. I wasn't aware of that. Can you give me a quick overview of the behavioral health services that you're offering now?
Yes, we received a federal grant on last year, and they gave us an opportunity to bring on staff or have contracting staff. And we just, presented to the board. We just thought it was more beneficial to us to have someone in-house. And it seemed like it was perfect timing for us dealing with COVID, because I believe a lot of the patients that he's seeing now is dealing with that, as far as the depression and so forth, and centering around this. But he's been a trooper, because due to the lack of space, he's seeing patients from our college location and in our east location. And so hopefully with that expansion, he'll have his own office as well as space to provide his sessions. But like I said, he's just been on board for, and it's Jason Bennett. I'm saying he, but he has a name, Jason Bennett. And he's been on board for 4 months, and slowly, but since it was the first time us having it, behavioral health here, it's pretty much asked him to help us lay the foundation for it. And with his prior experiences working with the other agency, he was able to come in and really do a yeoman's job. But we're still learning some of the things we have to put in place that we didn't have in place. He's been very patient with us, but from the first month until now, you can see how the population numbers are increasing.
Great. That's really exciting. Thank you so much.
Mm-hmm. Mm-hmm.
Others. Jesse.
Thank you, Mayor. Yeah, just piggybacking on Melissa, really excited about the mental health care. And I also wanted to sing your praises for bringing in dental health care, which is, I think, too often overlooked for low-income folks. And I was wondering if you could just briefly maybe elaborate on what dental care services are provided.
We have a school-based clinic at the Hillsman Health Center there in between Gaines and Hillsman Middle School, and in partnership with them, they restructured their gym. The back of their gym had medical behavioral health service with Advantage Healthcare is also partnering with them, and they also build a dental lab, and that's been since October 2019. And we are still searching for a dentist to oversee that particular those services. And in addition to that, the same dentist will oversee those new 3 ops that will be at our East location. So if they start in the summer and finish the construction by November, December, we need to have that dentist in by that time because, as you probably know, it's such a need. When we was working with the school district, they were saying for ours, the students, the need of just preventive, was doing a lot of preventive care to answer that question. And so we'll do the same thing once we have the children as well as adults at our East location once those sites are completed.
It's great news.
Awesome.
Any other questions before we take a little break? All right, John, Marcus, May, we can't thank you enough. Really appreciate you being part of the team. All right, everybody, we will reconvene in 8 minutes at 7 o'clock sharp with, let me get my crib sheet out, with DFACS, and then we'll hear from Project Safe, the library in Athens tutorial. Thanks, everyone.
Thank you all. Have a good rest of the evening.
And so I want to go ahead and turn it over to you to talk a little bit about your work right now. And then I have a couple minutes for commissioners to ask any questions that they have.
Well, hello, everybody. I'm going to go ahead and let y'all know we have not been using WebEx. So if I am faulty on my skills here, I accept any tutorials. We've been using Teams a lot. So it looks kind of similar, but if I make a misstep technology-wise, please please give me some tips. I do have a PowerPoint if y'all want me to share that. I'm assuming I just hit the share content and it's going to let me split screens.
That's right.
Okay. Let's see.
And it should give you sort of a little graphic and ask you what it is you want to share. There you go.
All right. Oh, y'all have jumped over to my other computer, so I'm going to try to.
Now we see it.
Okay, I'm going to get it to the front. And I'm going to cross my fingers. We've been running GETS updates on our computers that pop up and give us no choice but to, it reboots. So I'm going to hope for the next 20 minutes we don't see that little reminder. First of all, with our budget request that we submit, broken down monthly, this is how we use the funds that are provided to our agency. For support to our foster care youth and caregivers, providing support, and generally that support comes in ways that the state money does not pay for, or Amerigroup Medicaid does not pay for. We also have general assistance to the community at large who need assistance with bills, other issues. Prior to this year, we've provided a lot of transportation support, but a silver lining to COVID has been that with bus fares waived, that hasn't been a major need for everybody. We have continued to see most of that money this year for general assistance be dedicated to pauper burials in the community. We've also been able to do 2 salary supplements, retention supplements to staff that are paid out in July and January that increase over the years that staff have been with the agency, starting after 1 year. Then after 5 years, there's an increase, and after 10 years, they can get to a maximum amount. We have used the funding to provide some temporary contract worker support while we're working to onboard full-time staff, because we have a lag from when we interview to when we onboard. We've also used it for some staff development and training opportunities. Even through COVID, we have been able to get some folks through some virtual trainings to enhance their skills. Staff morale activities, we also use it to provide some dictation services so that the work can be done quicker. Supplements to our board members, as well as equipment and supplies that's necessary that may not come out of state funds. Let's see. We thank y'all very much for all you do. I do want to share some successes. I think we saw a lot of hurdles and changes to our business practices in the last year, but some of the benefits prior to COVID, we had some access issues for our customers with food stamp and Medicaid applications. Shortly after, or right as COVID was coming about, we were in the process to get SNAP applications and Medicaid applications online. Those are fully accessible online and has helped throughout the county with access. Another benefit of that is between Family Connection and work through Envision, we are beginning to see work for community partnerships, where Athens-Clarke County previously had 3 sites for community partnerships prior to Gateway. And when we went online, it seemed like there was maybe a lack of communication that there had to be a reapplication to become a community partner site. But now it looks like we are making some progress to get some community partners active. And we've also enhanced our virtual customer support. There are very few reasons customers need to come into the office to receive assistance and process their applications. They can call, speak with someone, get over-the-shoulder support over the phone. Also strengthening those community partnerships will help with that. But we are offering in-person support with appointments into the office. We have a virtual lobby system to schedule people to come in, even though the front doors aren't swinging open from 8 to 5. We have people in the office from 8 to 5 if individuals need an appointment. For the calendar year of 2020, we had 69 children enter foster care, but we had 90 kids exit foster care, which we saw as a huge success because, as y'all know, the courts and emergency orders, the courts kind of slowed down to a halt for a few months, but we were able to work closely with our stakeholders. At times when appropriate, we were able to circulate some orders for consent, and we saw 41 kids go home to their parents, 18 children achieve permanency through guardianship, 18 through adoption. Then we have 5 who went to the permanent custody of relatives for the purposes of adoption. And another change from COVID with our youth over 18, they don't have to sign back into foster care. They are in foster care. They have to make the conscious decision to sign out of foster care. And some of their benefits have extended through, we keep getting extensions while we're in some judicial emergencies, but we did have 8 individuals who decided that they wanted to be on their own and independent at the age of 18. Let's see. I have given y'all some snapshot data for Office of Family Independence, and the numbers did not broadcast on this, but if you'll see at the top of this slide, if there's an interactive website that at any point, if you want to go back and look through the last, I believe, 4 fiscal years, you can look at filter for Clarke County and kind of see the trends of data for households receiving medical coverage, households receiving SNAP, our TANF caseloads in households. I know we're always very interested in that data. And this might be really little for y'all, so I apologize. And again, it will show you applications received and processed, and then what's approved. Over the last several months, we've been operating through automatic renewals for SNAP benefits and Medicaid. Medicaid is continuing through automatic renewals through April of 2021. SNAP and TANF renewals, customers are now having to submit that information and case managers are having to work those cases. We're no longer under a federal waiver for that. And the definitions of this, and I can email this to if anybody wants to have this at any point. I know y'all have a busy night, so you probably don't want me to read you definitions on stuff.
But yeah, that'd be great if you could send the presentation there.
Yeah, I will. And then for our reports of maltreatment, and again, all of this data is located on the DHS data site that you can go through and look. And you can also find Adult Protective Services information, any of the DHS related data. For the child welfare, I did include the bar graph for 2017, 2018, 2019, and 2020, because I know that when I talk to people, they're very curious about how our reports have been impacted over the last year with the shift of COVID reporting. We did see our numbers drastically drop last March, April through the spring But we started to see an increase back in the summer, and we are back in February is historically a busy month, and we are seeing that right now. So that will show up in next year's data. For fiscal year 2020, we processed 1,478 intakes. You can see over the maltreatment allegations, for some reason, if you're looking at that, it will not filter county specific. So that chart is actually showing you statewide allegations, because you're probably thinking 100,000 maltreatment allegations, that's a lot for Clarke County. So that chart, when you're flipping through the data, does not drill down into county specific for some reason. This is also showing you our Child Protective Services programs. Our family support services are an assessment, but the allegations of maltreatment or neglect have not risen to an investigation threshold. There are some allegations, but the level of safety threat is not as extreme. So you can see our trend of cases decreased a lot in 2020. Our investigations also decreased, but not quite as drastically as our family support cases. A lot of the reports we are seeing are significant, allegation-wise. So, and then for family preservation, those are families where we have identified assessed allegations of maltreatment or neglect, identified some safety concerns in the house, but the families can remain legally intact with services or court-ordered services. We are focusing heavily to try to have families go through family preservation versus foster care. We would rather see these numbers higher than foster care and work with intact families and provide services. And hopefully that number will continue to grow. And this is a breakdown of the total number of children we served in 2020. This graph, I tried to get it to pop up to give you the total number of children, and then it breaks it down as best as the data is entered into the system for demographics. And then one other nice success is we recently added 2 new board members. Kyle Simple and Jeff Turner have joined the board, so we are grateful to have them as well. So we are now have a 6-member board. So that is the data that I can send. Are there any other questions? I think one question I get a lot is how many foster homes? How do I unshare? Or is there anything you want me to go back to?
Should be able to hit stop sharing, kind of hovering over the top of your screen.
Yeah. There we go.
Take a couple questions, Melissa.
Yeah, you showed us the data that was statewide. Is there any way to get county by county data? Was it? Can you go back to that slide real quick that had the one that was statewide?
So half of it, I think let me reshare. Hold on. Sorry.
Was it the number of allegations? Was the statewide?
Yeah. Are y'all seeing it again? Did it share? No.
It's not showing up.
Here, maybe we're coming. All right. Let me go back. Hold on. Okay. I think this is the one you're talking about where the maltreatment allegations over here are not filtered statewide. Is that what you're asking me?
Yeah. There was I'm just wondering if there's a way we could get those county by county. If we had an idea of how these accusations stack up in relation to other comparable communities, we might be able to, provide services or programming that might prevent that.
Right. Yes, and I can request a specific data report from our state office. For some reason, we used to get this data in a different way published, and it shifted a couple of years ago to this format. And I don't know what, it could be operator error that I can't get it to filter correctly. So I will ask about that, or I can request a specific data report from the state office.
Yeah, I'd be really interested just to know, how we stack up against other communities, so we could, think about programming or whatever that could help prevent some of this.
Yeah. Okay. Are there any other slide questions? I can only see 4 of y'all based on my screen. So.
Well, Mary, we really appreciate this, but yeah, if you could just email the presentation, we'll make sure to distribute to the whole group.
Thank you.
Thank you. I think Carol's trying to say something.
Carol, go ahead.
Well, I actually thought Jesse had his hand up, but I did want to ask you something. It's and I apologize, Mary, because it's really hard to stay focused in these Zoom meetings when there's so many presentations. I feel like I would be doing a much better job if we were there in person. Anyway, but in terms of staff, I'm just kind of curious what how the retention is with your staff and the turnover. I know that's really hard work, and I have the impression that the salaries are not that wonderful for the amount of work that goes into it. So I was just wondering how your retention is, how many positions you have, perhaps not staffed and such.
So right now we have 45 staff members on board. We're in the process of onboarding 12, which is significant for us right now. 7 of those positions are in the Office of Family Independence for SNAP, Medicaid, and TANF, and then 5 of those positions are in child welfare. I will tell you, for child welfare programs right now, our caseload to case manager ratio is 1:32, which is much higher than the national recommended level of 1:19. So we are advocating to fill some positions. I have also requested support from other counties in our northern district, so outside of our region, who have much lower caseload ratios, until I can fill some positions for morale purposes, because it is very tough for staff, especially right now. Because of Athens-Clarke County and the community we live in, I have a younger staff typically. They tend to live in apartments. This is their first job. So living on their own can be a challenge financially. And so a lot of the conversations I have with them and kind of mimic some of the work that's going on in the community about affordable housing for somebody who is making a lower salary. So that is a challenge. I will say, though, the state did a good job of raising entry salary rates several years ago. I don't think it's where we want it to be, but the entry level is around $35,000 a year, which is significantly higher over the last few years. We have lost staff this year due to probably regular job stress of dealing with trauma constantly and the stress that this job brings. But I have seen people leave because of the compounded effects of teleworking, that emotional stress that has come along with that, and simply staff may have lived here after college, but their family may be far away. And so the isolation component has really been tough for people. So we've been trying to work through that and offer some virtual support and what we used to do in person for wellness. We have tried to balance that in person because we realize what we do is hard to sit with, especially if you are doing this work from home and then staying in the same environment and not having a place to debrief what you're seeing every day. So We are understaffed. I don't have, the state shifted to a process where we no longer consider vacancies. There's a process to request positions each month, but I don't have an org chart that when somebody leaves, I can hold that vacancy there. So it's really hard for me to tell you I have X number of vacancies right now. I can tell you that every month my boss is tired of hearing from me because we need some more staff. So, but thank you for asking about that. I hope I answered your question.
Good question, Carol. One or two last questions before we move to Project Safe. Jesse.
Thank you, Mayor. Mary, I might love to follow up with you at some point, and thank you so much for offering to share the slideshow. But I was just curious, I was kind of, to be honest, skimming through the information that's in our packet, and then in your presentation, you had broken down the total figure into a monthly figure. And that got me to wondering whether the way that this money is being spent is really like roughly averaged out to be pretty flat month to month, or if we see spikes different times of year. I don't know if you have that kind of data on that kind of level, or if that's something that exists, but I'd just be curious if you know offhand, or if in the future there'd be a way of getting that information around, say, the seasons or the rental calendar tending to really spike for people transitioning in July, things like that.
So are you talking about the how we spend the money monthly and how it's broken down?
Yeah, I guess if the need for the types of the money that we're giving goes to certain types of assistance, and whether that assistance is more needed at some times of year than the other on average. Does that make sense?
Yeah, it does. We actually, so our regional accounting department is a secondary auditor reviewer, for lack of a better term. So we have a monthly spreadsheet that when the board meets, we review how the money has been spent, and it is broken down into each of the topics. I can tell you we pretty much are spending, we have a target to spend, the spreadsheet gurus have put, I believe, 8.33%. And we are currently for the year right on target to spend down to the end of it by the time we get to the end of the fiscal year. But it is broken down. I anticipate seeing a surge in general assistance. I thought we would already see it, but some of the COVID relief has shifted that. That does go in waves between peaks of high energy, cold snaps. We're not seeing that right now, though.
Thanks, Jesse. All right, Mary, we really appreciate the work that everybody's doing over there.
Thank you.
With everybody who's been in meetings with us tonight, this is not an easy time to be doing the work that you do.
Yes.
Thank you.
Well, I appreciate y'all. Who do you want me to send the PowerPoint to?
If you send it to Tim at Finance or to me, either way, we'll make sure it gets distributed to everybody.
Okay. Thank you all.
Good to see you. All right, we are going to move over to Project Safe, and we have Joan Pretty, Executive Director of Project Safe, with us tonight. Hey, Joan, good to see you.
Hey, how is everyone? Thanks for being here. And Carol, I can relate. My first one of these was at 7:30 this morning with a couple of members of the House Judiciary Non-Civil Committee about the dating violence bill that Houston Gaines and Spencer Fry are putting forward, and it goes nonstop, and these are kind of tiring. I did not make a PowerPoint. I'm just going to talk with y'all just a little bit, and then leave for questions. I like to keep these short and try to do my part to help make your night a little shorter if I can. The first thing I'd like to do, first of all, is say that I am in my office, which is in the emergency shelter. So if an alarm goes off, or if the emotional support dog that's I can hear right outside My window here on this wall, it starts going off, or, it's just life in shelter. But the first thing I'd like to do is update the numbers from your packet, because putting this thing together, right at the very early part of the year, and let me just say that social workers, God bless them, but getting their data into the data system is not always right on time. So I ran our numbers in your packet through December 15th of 2020. And I want to show you where we landed. So our hotline calls went up to 2,056 for the year. We sheltered 135 people in the emergency shelter. So I think that was just a couple up from what I presented. It's 763 clients in our outreach office. So these are folks who work with our advocates who are sitting over in the Family Protection Center. We had 29 clients in our longer term housing programs, which is a transitional housing initiative we fund privately. And then also we finally started, it tickles me to say, it was a 2018 HUD grant, but working with HCD, and we finally got to start that last year with that contract. So, you see that and that was for rapid rehousing. So you see that when we got the final bit of the December data in there, that those numbers really did increase. And, what happened last year with us is what has happened. It's been confirmed by our board member at the CDC and what we've seen tracking all over the country, which is hotline calls went down, client loads went up. So we actually, we sheltered 5 more people in emergency shelter than we did in 2019. We had 163 more outreach clients that we worked with in 2020 over 2019. We were flipping busy this year. We really and truly were. We did not close. Who knew? But we when we renovated and expanded our shelter, we did it in the perfect way for a pandemic. So, since our apartments within the shelter have their own bedrooms and bathrooms for the families, and since we have individual bedrooms for our single adults, which, can be men or women, we just stayed in the shelter, right? And we continued to work in the shelter. There was a period where we had folks in motels and on top of the shelter just because we didn't have space. We have certainly switched to some virtual services, and we give people that option to help maintain social distance. But we work at the shelter and at the Family Protection Center. We continued through the entire pandemic, our twice-a-week walk-in hours at the outreach office in case anybody just needed to walk in, but also, again, having virtual options for folks who need that. And then I do want to say a special thank you for we received $45,000 in CARES Act funds from Athens-Clarke County. I think that was through HCD. We served 27 households with that money. We spent it in 2 months. And just want to say how helpful that was to survivors to have that. Like always, we are lean. Got the audit back from last fiscal year, and 92% of all of our funding goes to programs and services, 8% to overhead and admin. Your CARES Act dollars, though, 100% of that went directly in the hands of landlords, and I think we paid 2 utility bills. It was mainly landlords. But we didn't use any of that for staff or operating or anything like that. We just to the families who needed those funds. So, the only thing that was different for us this year, apart from just the difference of providing all your services in the pandemic while you're living it and working with it, we did close the thrift store for about 2 months before we could regroup and figure out how to operate that safely. And so that was a big deal. But we had our thrift store employees doing other things. They were making peanut butter sandwiches and serving them out to the tent camp that's behind the Bell Shopping Center there. They were working with crafters, getting sheets and things like that for people who were making masks and doing deliveries of supplies to families in need. So, they were busy during that time. So, looking forward, there's the alarm. We'll just carry on. It'll keep going if it's something really important, but we've got some kids here and they tend to kind of set it off rather easily. We're going to continue the crisis response services that I detail in the packet that you have. That's what we're going to be doing. One thing that's new for us is expanding our stalking support. So the act of stalking is a tactic of domestic violence, for sure. But you can probably imagine that there's some situations where stalking occurs in a relationship that is so much at the beginning stages. Maybe you've just communicated online a little bit, or maybe it's students that are in the same class and one person is more fixed on the other. And where do you go for help if you're experiencing this sort of beginning type stalking? We hear a lot of people saying, well, the police or the prosecutor's office, the court said, they can't help me till he hurts me. Of course, they're talking about actual direct physical harm, but we see people whose lives are very disrupted with stalking, but they may not really identify it as an intimate relationship because they only had some online interaction or they only had a couple of dates. But the person who's doing the stalking is very fixed on them. So we already do a lot of this. We're just going to begin to put it out there more and create better paths for people who may not feel that Project Safe is for them, but where they can get help and support and some navigational help, because stalking is some tricky stuff to deal with. We're also really working on some of our collaborations and partnerships that we carried on through last year, but things like our firearm accountability group. We developed a protocol for civil cases, and that has been working well. And Judge Baird has given us some assistance with that. We've just started a child survivors group for child survivors of serious intimate partner violence or homicide. And one of the impacts of the pandemic is our state Supreme Court has issued continuing orders, as you know, which have postponed jury trials, have postponed. And so the district attorney's office that normally, takes these cases of really serious felonies where someone's very hurt or perhaps killed, normally those cases would be proceeding and those advocates would be doing things and they would kind of be playing point and referring to others of us and kind of connecting the dots there. There is a backlog of serious domestic violence cases from last year that have not been pursued because of that. And so we're working with folks, victim advocates at the DA's office on that. We're excited about that. And then the high risk team, we've got folks working with, again, other partners that we've always been working with. And we've done a lot of this stuff in a very perhaps less formal way, but really trying to get more cohesive. And what is our high risk team for those cases where we're not at serious injury or homicide yet, but there are the presence of those danger indicators, those lethality factors that make the skin on the back, the hair on the back of your neck go up. So we're really working on those things as well. So we get $26,000. It's not general funds. It's from the 5%. Which is set aside for crime victims. The larger shares of that go to the district attorney's office and the largest share to the solicitor general's office. We're just hoping to continue that so we can continue to give you the value that we give for that. And I just wanted to end with just this real brief letter that a former client had sent at the end of the year. And she wrote, I want to start off by saying that I'm very thankful and humble for Project Safe. Project Safe helped me when I was at my lowest, getting out of a very bad domestic violence relationship. You helped with rent, Christmas, daycare, and even helping me get my GED. Project Safe helped provide a tutor for me, and now I can say I officially have my GED. And then you put me through medical assistant school. The pandemic really had me at the point of giving up some days. I currently work at an assisted living where our hours were drastically cut. Families were taking their loved ones home due to not being able to see them. The less residents we had, the less hours for staff. On top of that, my youngest child was in and out of the hospital with pneumonia. Then I was exposed to COVID-19 at work and had to quarantine. I was so depressed, and I reached out to Project Safe, and you were able to help me during the pandemic, even though I was no longer in your housing. I will forever be thankful for that. Thanks for everything Project Safe has ever done for my kids and myself. You've really given me a new start and a better future. So that's just in the words of one woman of what we could do. But, so many folks, we know the danger in domestic violence is so often after the relationship. 75% of homicides occur after the relationship is ended. And where we saw a lot of hurt and a lot of difficulty this past year, and I think it's going to continue. I think it's going to continue when the rent moratorium lifts and some other things, is people who had already left their abusive partner and they had a place and they had a job and their kids were in school, and then the job cuts the hours, and then the kids are back at home virtual and they're trying to hang on, and that abuser is going, take me back. I'll keep you safe. I'll make it up to you. Come back home. You don't have to do this alone. Come back home. It'll be different this time. I promise. I won't hurt you again. Right? And this kind of this sort of pull, and people are wanting to stay independent, and they're wanting to stay free, and they're wanting to stay, but they're getting this pullback. And what we have been, it's like that playground Red Rover. We have been standing there with arms locked between that person and that abusive partner going, we'll keep you solid. We'll keep you in this place. We'll help you. And that's what's kept a lot of people from returning to something that would be really scary and dangerous and very harmful otherwise. So I'll just leave it at that and see if that prompts any questions from the commissioners.
Thanks, Joan. We'll appreciate the perspective that you're able to provide. Questions from commissioners? Jesse.
Thanks a lot, Joan. That was really helpful information and a really wonderful overview of what you all do and what people in the community face. Just had one question about the numbers. When you all talk about clients or people sheltered, like that 765 clients, I think you said it says 750 on the chart.
763 in outreach. It ticked up at the end. Yeah.
Is that referring to individual people or like family units?
Individual people. Okay. Well, in shelter, it's individual people because we count every person. Amongst our outreach clients, it is a mixed bag. So let's say mom, it's not always mom, but let's say mom comes in with 2 kids in tow to walk-in hours and sits down and meets with an advocate. We're talking about, what they can do together and safety planning with mom and the kids and maybe going and getting a TPO. Well, then mom and both those kids are probably they're going to wind up in our database. But if it's just mom or just dad, and there might be kids at home somewhere, but what the focus of the outreach advocates' work is with the individual adult, the survivor, what we have found is that we've been inconsistent in whether or not those kids get entered in. And it winds up, I think we're undercounting, honestly, if we think of who's benefiting. But if the kids aren't there and it's not directly about them and the services that are being provided, then it's very likely that they're not getting added in. And so that outreach figure of 763 is going to be a mixed bag. Some of specifically individuated family members and some probably just the adult that came to see us. Does that make sense?
It totally does. And I guess I just have one follow-up question, which is if you had an idea of roughly the breakdown of adults versus kids, And then maybe parallel to that, you know, how you might think of teens who might come to y'all directly and don't necessarily have like an adult that brings them there, but aren't
right
of legal adult age.
Okay, so let me see if I've got somewhere handy where it's broken out. So with shelter, which is going to be the best number, it was 72 adults and 61 children. We do sometimes get calls from teens who need shelter, and we do shelter them. So we have had unaccompanied minors in our shelter. They moved in with a boyfriend, or they've run away, or they, you know, whatever has put them in a place where home isn't safe, and whoever they're in a relationship with isn't safe either. And we have sheltered young people in that way. We do not get as many teens, for example, coming into our outreach office. We have our dating violence text line, which is typically marketed to teens, but in the pandemic, when we felt that people wouldn't be able to maybe pick up the phone and talk on the phone when they're quarantining with, or sheltering in place with an abuser, we thought texting would be easier. And so we know that a greater proportion of our texts were from adults this past year. But one of the things that our staff and interns did last year, they wound up creating 54 videos on social media, really targeting particularly younger people, but people that we would normally making presentations to, and we weren't getting into the schools like typical. So usually with teens, where we're working on with them is through the text line. And we see fewer of them individually coming into the outreach office. More typically, we would see them when our staff are in the schools, and then they're coming up afterward, and there would be meetings in that way. But we've made a concerted effort over the last 8 years to really beef up our game with teens and young people, especially. And even branding that differently, that's called breaking silence. And we do that because we figure, they probably think Project Safe is where mom or grandma goes when they need a place to stay. And of course, we do so much more than that, but we wanted to kind of create this separate thing that was targeted to teens.
Any other questions for Joan? All right, Joan, can't thank you enough. Just have a good night, okay?
All right. Thank you so much. Appreciate it.
Talk to you soon. All right, everyone. We are going to transition to the Athens-Clarke County Libraries. And I think we've got a handful of board members, and I see Director Valerie Bell on the call. So Valerie, I'm going to go ahead and turn it over to you and let you introduce your team and take it away. You're muted, Valerie.
Thank you. It's a pleasure to be here. We do have some slides to share, but first I'd like to introduce you to Jane Russell, who is the Athens-Clarke County Board of Trustees Chair, and she will be making the presentation. So, let's see what I can share. Thank you.
Let's try it again. Are we connected now?
There it is.
Thank you. Good evening to all of you. Glad to see you. We'll go ahead and start. Valerie and I have put this together, excuse me, hoping that we can share helpful information about the library and all that it's done this year. As Valerie mentioned, I'm the chair of the Board of Trustees here at the Athens-Clarke County Library at this point. And obviously, we're, even through the pandemic, working on engaging communities and exceeding expectations. So next slide, please. Let's see if it wants to play. There we go. Throughout the pandemic, we've been working really hard. The library staff has been working very hard on serving the community, expanding the digital collection by 80%, doing interactive reference chats, live online tutoring with tutor.com, which I will reference again later, comprehensive virtual events on the calendar, and then a curated list of vetted information on COVID-19, on the elections, and some other activities. The virtual programs, we have done streaming short story times, summer reading program, virtual computer classes, virtual author visits, online book club meetings, Heritage Room one-on-ones. Next slide, please. There we go. Beginning in May, we started, the library started curbside service once things were safe for the staff and for patrons. And as you can see, everyone is masked and gloved when they're providing this kind of service. And it's been very effective. Some of you may have taken advantage of it. I know I have. It's been extremely helpful, and the staff, I think, has felt quite safe in doing this and providing this kind of service to the community. Next slide, please. Then beginning in October, again, when we thought that things were safer for everyone, there was a so-called grab and go service that began at certain hours that the libraries open. And the different, in Athens, I believe it starts at about 3 o'clock in the afternoon, and then most of the day on Saturday. But it's safe library visits, crafts to go for children and teens, passports by appointment, and computer usage. And you can see from some of those photographs how people are managing this kind of thing. And if folks come into the library, they were expected to stay no more than an hour, but to come in and do what they wanted to do. And sometimes it's just picking up holds, but it could also be other activities. Next slide, please. And this is a short video we'd like to show you identifying how entrepreneurs can enhance their skills by coming to the library.
I was trying to come in and find information about Photoshop and Illustrator so I can make my invitation for my son's birthday party. And once I came.
I'm sorry, my apologies.
I was trying to come in and find information about Photoshop and Illustrator so I can make my invitation for my son's birthday party. And once I came in, and you all have different resources, then that's when I really tried to scratch the surface and pursue my career in graphic design. It saved me a lot of money, especially the software. The software is very expensive, so me having the ability to come in here and use you all's resources was basically a lifesaver for me. I've been currently working on my shoe line and doing flyers for my track team, promoting my track team, different marketing stuff for different people. I also entered like a couple of competitions for Rap Snack, Slutty Vegan, and Puma and Foot Locker. It's the World of Sneakers competition. I just try to break into like the graphic design industry, just really promoting my track team. And I also like design my own uniforms. So whenever you see our athletes in like a year, it'll be something that I designed myself. Hopefully, continue to pursue my career in graphic design, whether it's work with local businesses or breaking into like the graphic design industry, or simply keep on designing my own gear for my track team. I also wanted to learn about video editing because I have a lot of footage of my track team, and I actually want to like slow it down, break it down, and so I can go over like the fundamentals and what they did correct and what they did wrong. So that'll be a great teaching moment for the athletes. And I also can make their footage for college. So pass it out for like recruiters, make them a little highlight tape film, anything that'll give my athletes exposure to like go to the next level. I love coming here. I'll probably continue to come here every day. Like this is like my second home. Athens Regional Library System, engaging communities and receiving expectations.
Okay, thanks, Val. That's the extent of our video and slide presentation. We'd like to point out a couple of things, or about three different things on the actual budget. First of all, and I think this is just an overall statement, the library, as many community resources do, offers an extremely good return on investment in terms of what the county commission so graciously provides to the library. This year, they were able to get about $42,000 in grants, which supplemented what the commission has been able to provide to the library, and that's, of course, been a good thing. There are three points with respect to this coming year's budget that we'd like to highlight. The TRS increase that's mandated is a total of $7,000. Requesting a 2% pay increase for the salaries for staff, that would be a total of $18,000 and would also help with maintaining staff, lowering the attrition rate. And then adding 12 hours per week at Pinewoods, East Athens, and Lay Park centers so that there can be more staff involvement with those communities. That we think is extremely important, and that totals $22,000. And then with respect to our impact statements, again, that short video that you saw, I think highlights a lot of the adult learning that can go on that goes on at the library. Second impact statement that's important to us is cultural and civic engagement. This year, there were 950 Heritage Room visits, which could be done by appointment even during the pandemic, and over 2,000 requests for information that the staff handled. There's also a state park pass program that 500 people were involved in. In terms of people in need, which is another impact statement that's important to us, there is now a Chromebook lending program that the library has put in place, and there are mobile hotspots that are available around the community, or will be beginning in March, because the van that the library has been retrofitted and can get out into the community and provide internet access for folks who find that difficult to get to. And then with respect to student success, something that just started at the beginning of February is called tutor.com. And students can go onto the library's website through tutor.com. And this has been funded through the regional board 7 days a week from 2 in the afternoon till 9 in the evening to get tutoring support for work that they're doing in school. So that is, I think that pretty much highlights what we're trying to do for the coming year. Again, thanks as always for everything that the commission has provided to the library. And I think we're ready for questions.
Thanks, Jane. I appreciate it. Questions from commissioners? Jesse.
Thank you, Mayor, for this presentation, y'all. I'm glad I get to see the video of the person y'all were referencing making all those shoe designs. That was cool. So the 2% salary increase for staff, is that 2% across the board, or is it a 2% increase overall to bring up the people at 10 an hour to $11.56?
It was basically, we looked at it as 2% across the board. We have people in different positions at the library. And so in order to be fair to them, we have people with master's degrees. So in order to be fair to them, we felt 2% across the board would be the best way to go.
Okay, so the starting wage would basically go from 10 to 10.20 an hour. Is that?
That's it.
Do you all happen to have figures on what it would cost to bring the base pay up to that living wage figure?
I do not. I would be happy to get that information for you. But we do have, as I said, we have professional librarians who are working for $13 an hour.
Well, if that's something that y'all would like to put together, I'd love to at least see the figures on bringing the wage floor up. And then I guess if there's another sort of parallel figure of what it would look like to appropriately adjust other people to address that wage compression issue, sharing both would be very welcomed as well. So.
I would be happy to do that. I'll get that to you ASAP.
Thanks.
Thanks, Jesse. Others? Carol.
Yeah, I want to thank you, Val and Jane and everyone else on here. I echo what Jesse is saying there, and I need to look into this more, but I would like to understand better, and it might be right here in front of me, but I printed out a lot of pages. But what percentage of the salaries comes from the state versus from Clarke County. And like I said, it may be right in there. So when you send Jesse that, if there's any breakdown of the funding source that's not in there, someone else can point it out to me as well in here. I'd like to understand that too. I really feel that the library is one of the best resources in this community about serving a cross section of everyone. And you guys are a resource I use a lot, and I see everyone else there. So I really want to make sure that we are supporting the library the way we should be, because you guys, are just give such a good service to the community. And likewise, I want to say I talked to Val already. She gave me a tour, as she did to Commissioner Houle, and any of the other members of the board who are on here too. As a commissioner on the east side, I'm very, very, very interested in doing all I can to help us get the best library on the east side as possible. So if anyone wants to reach out to me on that or follow up in any way, I just want to make sure you know that I'm available for that, because that's I'm very, very excited about that for the community and for the east side. So thank you.
Thank you so much.
No, I think we're all excited to see that expansion. Glad that it's on the near horizon.
Yes.
We've got our SPLOST tiering underway. I had a sort of a comparable question about the budget. Val or anybody else who can help me with this. Looking at your agency revenues, noticed that there's this consistent decline in federal and state grants. Is that a decline in the operating supplement that the state provides?
The state grants, you mean from last year?
Well, I noticed that in the row titled Federal and State Grants in FY20, it's about 985,000. FY21 about 957, anticipated to be 897 in FY22. So it's something nearing a $50,000 drop every year, and so is that representing a drop in operating dollars from the state of Georgia?
Honestly, I'm not sure what piece that is, but I believe that Mamie Fike, are you on this call? She's our business manager, and she may be able to answer it a little bit better. Mamie, are you here?
I don't see your name.
No. So I'm not sure exactly which part of the budget you're talking about. The salary line from the state has maintained. It's my understanding that the salary line from the state has maintained. So I'm not sure what area that is that we're talking about.
I'll just follow up with you, Val, via email and
Okay.
find a little more, because if we need to be advocates for more appropriate funding from the state, we want to be able to do that.
Well, now, one of the things that we said in our goals and objectives was that we were hoping to get on the state capital outlay for the East Side branch in October, but we managed to get on the state capital outlay for the East Side branch. We're number 14 this year. And so the legislature is looking at all of that now. So any support we can get from commissioners, writing or talking to state legislators to move that funding up would be greatly appreciated. We've asked for $2 million in addition to the funding from SPLOST for building that building, for building the East Side.
Thanks for making that note. I appreciate it.
Yeah, we'd appreciate any help. We've been writing, and the boards have been writing, and our friends groups have been writing, but it would certainly be nice to hear from the elected officials in Athens.
Yeah, Kara.
Can I just ask Val if you would sort of, I don't know, maybe you have a letter or something that already summarizes that, what you're actually advocating for. I'd appreciate seeing that, so I understand it better.
Sure, I can send some talking points.
Yeah, that would be great. Thank you.
Any other questions for library staff? Well, thank you all for what you do. You're a great resource.
Thank you. And we know that that the Board of Commission has been very supportive of the library. We were concerned this year because we know that, with COVID, it was going to be difficult for departments and agencies for you guys with the funding. So we went a little lighter this year than we normally would. And but the things that we've asked for, I think, are very important. Pine Woods, East Athens, Lay Park. I think we can make a real difference in the lives of those community members if we had just a little bit more staff to work with the community and actually get out there and engage that community and not just be in the buildings, which is what it was before. So we're looking forward to that.
We are looking forward to being back in the buildings too.
We're working on it. We are working on it. We're making an assessment right now for output measures for grab and go and curbside service. And so hopefully very soon we'll be making changes in the hours that we're open so that we're open more hours for people to come in. But there's a lot of people that really just like the curbside service. And it's not just seniors or people who are afraid of COVID. Sometimes it's just, parents who don't want to have to go through pulling out the stroller and all of that and getting information. And so, we have something that we call concierge service. So, patrons can contact the library and just say, I'm interested in books on dinosaurs, or I'm interested in this title, and we'll pull the books together for them and have it available for them to check out. So the team, I really do have to praise the team of library staff who have worked so diligently and so hard throughout this pandemic, many of them working from home using their own equipment and, making sure that what we like to say is that the facility, the building was closed, but the library remained open. And so within a week after after we closed the building, we wound up going virtual. We moved all of our collections onto an electronic platform, and we stayed open. So even though the library building itself was closed, if people needed library service, we made sure that that was available for them.
Well, the community really appreciates your creativity, without a doubt. Y'all, please have a great night.
Thank you. Thank you all very much.
Thank you.
Absolutely. All right, commissioners, we've got just a single presentation left from Athens Tutorial.
Hello.
Hello. Good evening. How are you tonight?
All right. How you doing? Let me. Can I add another person? Because I have another person that I need to add to it. Is that possible?
Absolutely. If you just forward this link.
Okay. I can't just add it with my phone and call the person and get them on like I usually do with conference call.
So on the WebEx platform, they'll just need the link or the dial-in number. So if you take the email that you got from staff and send that on, we should be able to get them on.
While you're on the line, let me text her right quick and so she can get on. Okay, just hold on. Thank you. Okay. Okay, hold on. Let's see.
Should be able to get through.
Okay, hold on. Okay, so I've sent it to her, and hopefully she can get on. But anyway, I'll just go on and get started until that happens. Can you hear me good?
Yeah, we can hear you well. So just introduce yourself to the commission and go ahead and tell us about how the year has gone.
Okay, I'm Aaron Hurd with the Athens Tutorial Program President. And of course, I think you read the information. The reason I wanted to get her on because I think you may have the right proposal or you may not because there are some other changes that were made, and I don't know if the right one was sent to you. But anyway, let me just kind of recap and talk about a few things so that you all can have questions and ask us. Because, we're in the COVID year, and it's a little bit difficult with what we're having to do now. I think the proposal says that we would have 75 students. We now have 65. 66. However, However, we are transferring some services, and let me explain what I mean. We're having the issue that we're having at Gaines. We're in two places. We're in three places, but we're in two schools, Gaines and Stroud. And the issue that we're having at Gaines is that they don't seem to be able to virtually access the kids in the communities that we are dealing with, and basically it's the Nellie B area, because there's no parent contact when the teachers or tutors get on the video, and so because they're having problems, it makes it difficult for us to be able to have those students within our program, because we pay teachers to log on with the students and teach them with from the virtual format. So what we are having to do is we have tutors in our center over on McKenna Drive in East Athens. So what we're having to do is to add more tutors and pick up children from elsewhere in order to compensate or make up for what's not happening at Gaines. Now at Stroud, we're not having that problem. And so we're operating right now with two centers, the East Athens Tutorial Center and Stroud Elementary. And we had to add another teacher over at Stroud in order to try to compensate even further, for having that loss over at Gaines. I'm just trying to highlight some important things so that you could have questions to ask us other than what's on the grant. The kids in our area where we are concerned about, because they are not able to get on out at the schools, are basically failing. We've talked with Mr. Robertson. He's like an outreach person. And what they want us to do is to be able to bring the kids in the center and have them to sit down and be tutored. But we can't do that because we're not equipped to do that. We would have to purchase a lot of different equipment in order to accommodate that. Plus, we don't want to be responsible for any kind of COVID situation that might arise as a result of having them in there. So we don't have the expertise to do all of that right now. So we are having to still operate from a virtual standpoint in order to, number one, get our numbers and accommodate the students with that learning. Now, it presents a learning problem, of course, because the more they're not connected, the more they're going to get behind. Now, the schools has mentioned to us that they will have summer school. And what we're planning to do is to incorporate a summer program to catch those kids if we can't catch them between now and the school closing, to try to help make up for that. But here again, as I said a little earlier, it's kind of difficult to do it the way we're doing it, because you can't do it face to face, of course, and it makes it difficult on us because we've never seen anything like this. But that's kind of where we are. But I think having 66 children, I think it shows that we are still not only reaching out, but we're trying our best to not only meet what the grant says, but at the same time, we're having the kids to come in so that they won't fall that far behind. But that's kind of where we are right now. And this COVID is one thing that we just can't get our arms around in terms of how we need to reach the kids a little bit better than what we're doing. So that's kind of the dilemma that we're facing and the challenges that we're facing with the program this year. But we feel like once they open the schools, and I'm sure you're all aware of it, once they open the schools March 1st, K through second grade, and then the 15th, 3 through 5, and then 29, 6 through 8, we'll pick up, more students, and hopefully it'll be better than what we're doing right now.
Thanks for that overview, Mr. Hurd. I really appreciate it. I am among those who are counting down the hours until live elementary school returns to activity, given the overlapping responsibilities I face right here. Parent of a second grader. I think your colleague was able to join.
Yeah,
okay.
I'm here.
Oh, good. Okay, good. Well, this is Laura Renberry. She's our program specialist and data analysis person. And, she works directly with the school and the tutorial center. And I've kind of given them an overview. And I talked about Stroud, talked about having to add most students and tutors and teachers to compensate for what's not happening, at games. Ms. Renberry, would you want to kind of elaborate a little bit more on the situation at games so they can get a better feel, because you directly deal with the schools in that respect?
Yes. The problem that Gaines is having is their students don't have an adult or somebody at home with them to make sure that they log on when they're supposed to log on. So that's the problem they're having. But what we were hoping once school starts is that we could get more of the students that may not be working out at games. We could direct them to our center and maybe give them more of a one-on-one type of thing.
That's helpful, and I appreciate you looking at the summer as an enrichment opportunity. I think a lot of school districts and certainly families, are recognizing that there's going to be this long-term recouping of skills that didn't get all the development that they normally would have seen this last year and a half.
Right.
Questions from commissioners for Ms. Renberry and Mr. Hurd? Kara?
Yeah, I just want to say thank you for the work you do. And I realize it must be very difficult and frustrating to not be able to work with the kids. I was doing some work the other day with another commissioner at Bethel Homes. And when I was knocking on doors, I had a bunch of kids who were answering, and I could see they were sort of supervising their younger kids, their younger siblings doing work. So I appreciate that. And I know that those kids are going to need a lot of catch-up work. It's been a rough year. So I just wanted to really say thank you.
Okay. Well, yeah, we appreciate that. But if anyone, if you have any kind of suggestion that we can take and use and implement it to kind of expedite some of the issues that we're having, we'll be glad to look at that. Because our thrust is to make sure that these kids get what they need to get. And I know I grew up in public housing myself in Athens. And I know that if they don't get a foundation in education, they'll have problems the rest of their life. And I think now is the time for them to get that foundation so they can be acclimated and get introduced to education so they can understand what it's all about. And I'm especially sentimental about that because again, I grew up in public housing here, And I know how things are. I know how you can get branded and named, and things can be said to you where it can kill your spirit. But as you and I know, we know some of the best people that have been placed out in society has come from public housing. So, you know, we'll continue to do our work irregardless of what happens, because we know that if we can save some children, I've heard the term, if we can just save one. No, we want to save more than one, because one is not a good percentage for what we need out here in our society. And that's one of the reasons that we keep doing what we're doing, because we know that one day, if they can get what it is they need to get academically, you know, they would appreciate it. Whether they know my name or Laura's name or anybody on the board is not really significant, but if they can get what they need to get, I think once they become an adult, they can appreciate it. So that's why we keep doing what we're doing. Yeah.
Follow up, Carol.
I'm just going to follow up, Mr. Hurd, because I was thinking with suggestions. I don't have any suggestions, but I have been working some with the neighborhood leaders on the east side. And I know Latasha Sheets is connected to the Whit Davis area in the east side and over towards Gaines School. And then also Tanisha Brooks. I met with her recently, and I know they're doing some creative things. So have you all tried sort of connecting with, have they connected with you or vice versa? Because
not yet, but we will, though. I mean, we will.
Yeah, I've been actually very, very impressed with the two of them. So they have a lot of creative ideas.
Do you have their numbers?
Yeah.
Yeah, that's a great connection, Carol. I'm glad you mentioned that. We can absolutely put you in touch with them.
Yeah, I have the. Do you want me to put it in the chat, or you can? Please. Yeah. Okay, I'll try to do that.
Could you just send that information to Mr. Hurd after the meeting?
Sure. Do you have a number that I could text it to you? That would be nice.
Sure.
Yeah.
Yes.
It's 706.
706.
Yeah.
362.
Okay.
1228.
1228. Okay. Yeah. I'm gonna take a picture of there and send you that. 706-362-1228.
That's correct.
Okay, great.
Thank you so much.
You're welcome.
Perfect. It's a great connection. Any other questions for Mr. Hurd or Ms. Remberry? All right. Well, to both of you, thank you for your work. We really appreciate it. Thanks for joining us tonight. Hope you have a great rest of your evening.
May I mention something to you that might take 2 minutes?
Please do.
I just want to mention to you. And I mean, and, you know, we're trying to, you know, meet the grant needs for this year, but we are also applying for a grant. And as a matter of fact, Tiger Woods, one of the organizations that we're applying to, because he has a program somewhat like what we have, or we have one like what he's got, because, you know, his is bigger. And because he was in a wreck today, I'm sure you heard about that. But the program that we're looking at applying for, we also will be applying to the COVID organization. We're looking at having our students. We're going to produce memorial videos of those people who lost in the state of Georgia, who lost people to the COVID, and the student will adopt that family. And that student will give their name, what they want to be when they grow up, and some condolences to the family. That'll come on the video before the presentation comes on. And the reason we want to look at doing that is because we want to get them, it's kind of an enrichment part of what we're doing, along with the academics, to let them get involved in somebody that's having or had problems, you know, worse than what they're having in some ways, and let them get connected with somebody who has lost a loved one to a disease that's, you know, hadn't been controllable up to now. I think they're going to get a handle around it. But we're looking at writing a grant so that we can have the children connected to that so they can get acclimated to something other than, you know, what they normally see. And we thought that would be an enrichment that they probably would never forget. So I just wanted to mention that we haven't done it yet. We hadn't sent it out yet, but we're writing on it right now.
Great.
But I'm sending it to bigger foundations so that we can, you know, be able to produce. We're looking at maybe 100, 125 produced in a year, and it's a 3 to 5 year project that we're looking at.
Well, please let us know as that evolves. Keep us updated.
Okay, I just wanted to mention that to you all.
Absolutely. All right, well, commissioners, we're glad to have Mr. Hurd, Ms. Remberry from Athens Tutorial here, and hopefully this was helpful for everyone, particularly Carol and Jesse coming on board. I think as Blaine mentioned at the front end, the intended cycle will be to every other year as new commissioners come on board, have every one of our independent agencies present, and then on the off years, just those that are seeking a budget increase for a new program. And we will be back here on Thursday at 5:30 to talk to 7 other independent agencies. So, without further ado, everybody, please have a great night and be safe out there.
Thank you.
Okay.
You all.